All right, we're going to get started. Good morning. Good morning, everyone. Good morning. Welcome, and we are very, very happy that you all have decided to use your Friday morning here to talk about an issue that is really near and dear to my heart and the heart of my esteemed colleague, Deb Lucan, and she'll introduce herself in a second as well. But just as a little bit of background, I am a professor here in the College of Ed. Most of you know me. But in terms of my background, I actually have quite a bit of experience before coming here 13 years ago in college student mental health, working in different psychological service centers on campuses. And actually, after I completed my doctoral degree, I worked for a year and a half as a psychologist in the CAPS office at Fresno State University, before I was recruited to work at the VA hospital with post-traumatic stress disorder, people who were experiencing that, and my career shifted a bit. So, college student mental health is something that I think is extremely important. In the time that I've been here, I know that I've been able to assist individuals, students who have come to me with different types of mental health issues. And today we really hope to engage in a lively discussion with you all about this. We are hoping that you will be able to really leave here with an increased understanding of how college student mental health issues present in the classroom, as well as some of the resources on our campus and some tools to be able to utilize in the classroom to assist students who are having issues and who may present them to you as instructors. So that's my introduction. I'm going to turn it over to Deb.
All right, I also welcome you and thank you for your interest in this really important topic. So just a little bit of background on me. I am a lecturer here, and it sort of scared me to discover that that's been over 20 years. So that was a little bit of frightening news, but I've seen a lot of different cohorts and generations of learners kind of come and go. So it's really interesting to look at the trends of different students. We'll be looking at that a little bit today, and just the societal pressures that impact students in an educational setting. So I'm a marriage family therapist by trade, and that's my background. So I had a private practice for many years. Many of those clients were within our kind of parameters of students. They are high seekers of mental health services, which is kind of interesting. So I've done that for many years. I work for the Board of Behavioral Sciences that establishes criteria for marriage family therapists, and along with Dr. Ghafoori, I'm the assistant director of the Long Beach Trauma Recovery Center right up the street here on 7th and Atlantic, where our focus and our specialty is dealing with individuals who are survivors of trauma or crime. And so, sad to say, that traumatized population overlaps in many ways with our student population. So that's a little about me.
All right. So actually that's a great segue, because we did want to talk to you a little bit, at least introduce you to the Trauma Center as well, since Deb and I both do work with the Trauma Center, and actually we end up serving a lot of students who have trauma issues prior to coming here, while they are here, and sometimes after they leave as well. So the Trauma Center is a campus center. We do have a location. Our primary location is in St. Mary Medical Center, and that was really intentional. We provide no-cost services to individuals who have experienced different types of traumatic events, and that particular zip code tends to be a high-crime area. But we do also offer services on campus here as well in our community clinic. Thank you to Shireen, because she has given us a couple of offices. So we have clinicians who are here on campus serving our student population as well. We are at the police station, and this year we're at Jackie Robinson Elementary School providing school-based services as well. So we're kind of expanding, I guess, in terms of the need is there. And
can you speak to the law avenue child? I think that's really powerful.
The average meaning, okay, yeah.
The income level and the number of traumas.
Most of our clients make under $12,000 a year. So we are looking at about 75% of our clientele make under $12,000 a year. So it's a very, very low-income population that we serve. We don't necessarily only serve that population, of course. Most of our clients have experienced multiple traumas. The average number of traumatic events that they experience by the time they get to us is 6. So this is a population that, of course, has gone through a lot. And in terms of the types of traumas, we see everything from sexual assault, domestic violence, community violence, human trafficking, loss, traumatic loss, and other types of issues as well.
I wanted to just add a thought on that too, in terms of what Bita's saying too about what we consider to be complex trauma. An individual who might have had trauma starting in childhood, and then they have just an increased sort of vulnerability, so they're really an at-risk population. So by the time they get to our campus, they may have a long history of traumatic events that they're bringing with them. So it's typically not a discrete incident, although we do see those where someone is assaulted. But oftentimes we see that individual, and as we start to uncover their history, we find out that there have been many, many, many other situations. So they're coming into our classrooms with long trauma histories, some of these individuals.
And just one other fact that I thought you might be interested in. We opened our doors for the Trauma Center in 2014. We have seen 3,200 individuals. I just got that latest stat yesterday.
That's a big stat. That's a great
Which is
stat.
crazy. And 12% are our college students. So I just want to highlight that because many of those students are in our classrooms. And I know that we are not the only folks who see individuals who have these types of events. CAPS is also available, Campus Psychological Services, and of course some people may even seek services elsewhere or not seek services at all. Yes.
I have 2 questions. One is about seeking services. So if a student couldn't seek CAPS, could they go there?
Yes.
To St. Mary's?
Yeah, they could even come here.
Okay.
Yeah, so they don't have.
Even if like if they lived in that area and it was more.
Right. And often they'll go to CAPS and maybe there's just too much intensity because they're short term. So they might refer them directly to us, or they might do some services with CAPS and then continue on with us. So we work in partnership.
Someone could even walk in.
Yes.
You could do a walk in, I guess. Is what I'm saying.
We have we prefer to make an appointment, but we do see walk-ins, so they can come to St. Mary's. They could also call us, and we get them in within 24 hours.
Related to that, last question is the physical building that's across from St. Mary's?
Yes, it's
Sort
not
of
exactly across.
sharing a parking lot.
That's the center, or is it inside the St. Mary's campus itself?
It's in the St. Mary's campus. That building that's across the street used to be a Cal State Long Beach Center.
It still has a sign on the side.
It does, yeah. But apparently it's not anymore.
Okay.
Yeah.
So we share the
we are in
parking
St.
lot, so
Mary's
we're the
campus.
medical building.
Yeah.
Yes.
I hope you don't mind just getting one questions. I was just curious if you had data on the ethnic or the racial breakdown of your clients, because there are certain cultures that are very resistant to therapy. For example, Latino culture, we don't seek out therapy the way a white middle-class person.
So we have about 63%, I just ran these stats yesterday, so they're fresh in my head. 63% of our population self-identifies as Hispanic that we serve. So it's the majority of our population. I think that there are many reasons for that. I could probably go into a long discussion about that, but I think number one, we try to be very, very open and inviting to individuals who potentially may be monolingual Spanish speakers. We have half of our staff and half of our students are Spanish speaking. So I think that potentially helps.
It's kind of a deliberate attempt on our part. One of our missions is to reduce the barriers for people seeking mental health services. So cultural barriers, language barriers, financial barriers, all of those are barriers. So one of our goals is to reduce those barriers. So we have a cross-cultural team. We have the Cambodian population surrounding our doorstep too, who are not major mental health seekers. So we really tried to educate ourselves and to get out into the community to provide culturally relevant services as best we can. And when we go to an event, we get a pouring of people calling us within the next few weeks.
And most recently, and education, as you see, is part of our mission as well. Most recently, we've been invited a lot to a lot of different events on campus, which is great, because we want to be available to our students on campus. Yes.
Can do your presentation?
Yeah. That's fine.
Can you repeat the statistic you said about how many students, was that 12%?
About 12% of our entire 3,200 is our referrals from campus. Mostly CAPS, but not necessarily only CAPS. Yeah. Okay, so I think we kind of covered this. All right, so we do have some objectives today that I want to just briefly go over. We would like to discuss common mental health issues among students, including Gen Z students, signs of distress that may be noticed in the classroom setting, how to respond to students with mental health issues, so really focusing on some tools. And then we have some guest presentations. I invited the director of our campus psychological service center, Bang Ju Huang, and also the director of disabled student services, Carmen Varela, and as well as Larissa Hamada from Equity and Diversity. And then we would like to end with self-care for faculty, considering the fact that this is really hard work. We all have workloads that are difficult to manage at times. And when we have students who are experiencing different types of mental health issues, sometimes that is a different challenge that potentially may be taxing on us as well. So that's a little bit about our plan for today. Okay, as you all know, mental health issues among college students is very well documented. There is quite a bit of literature out there showing that individuals who come to college and are here in the college setting have different types of mental health issues that they may deal with, and ranging from mild issues such as adjustment to college or relationship issues to relatively severe issues like bipolar disorder, autism, ADHD, schizophrenia. These are all different types of issues that our college students potentially are dealing with and that potentially come to us with as well. We also know that when our college students experience these types of issues, they have a likelihood to have lower grades. They potentially have a likelihood to drop out of college, be underemployed. So it even makes it more important for us to be able to understand and intervene when they are here in our setting.
No, other than the fact that I think that we're going to talk in a little bit about how these students present in the classroom. What kinds of things are we going to be noticing? And we have, as Bita said, a wide range of potential problems that people can bring. So I'd like for you to maybe think about your students as they come into your classrooms, as they participate in the different activities. And we're going to look at some of those areas in which they manifest this because their educational work is obviously going to be impaired. Their social skills, social life is going to be impaired, and then moving on to the employment issues.
Yeah. So I think that we put this slide up there. What comes to your mind when you think about the mental health issues that our students potentially may be facing? Is there anything in particular that comes to mind that we could potentially address as we move through this presentation as well?
I always just think, worry about students just being lonely and isolated when they have college, feeling like it.
That's really interesting because we're going to talk about that a little bit as we get to Gen Z. But that is one of the challenges for college students anyways, especially at more of a commuter college, that there is a typical adjustment reaction that students have to go through, which can manifest as depression or anxiety. And so it can be very difficult for some of them to make that adjustment to kind of find their niche, their place. And we're going to look at some really interesting issues. So that's intriguing that you brought that up, because Gen Z has been described as the loneliest generation. So we're going to come back to that, but that is a factor. When you look at the fact that they've grown up in a technological environment, and so they're described as the loneliest generation. Interesting.
I have a student who's currently in my master's degree program who emailed me this week to tell me that he's been clinically diagnosed with depression. And he asked me whether or not he thought he should continue in the program. And so I'm curious to find out what you have to say about how do we address this as professors, because I feel like it puts us in a delicate position.
Indeed.
And it's really hard to address when somebody asks you that, and something like that.
Yeah, and I think that that's a really important question, and I agree with you wholeheartedly that it is delicate. I hope that you leave here today with potentially some information that may help you to address that issue. But we've had students who have come to us with telling us that they have depression or something else, and asking us whether or not they should continue. And I will tell you that there are resources on our campus to address issues such as depression. So my personal advice has been to kind of do like more of a stepped approach, to potentially ask the student to try to address the issues, maybe by our campus-based resources or outside of our campus, and then see if they can continue. But it is very challenging.
Because there are consequences either way for the emotional health of that student. If they drop out, there are emotional consequences. If they stay in the program but they're struggling. So it's a tough decision, and it's one of those difficult things that one size does not fit all. Every student's solution is going to be a different solution.
Yes.
I always thought, because over my career I've worked with students who were like 18 to in the doctoral program like 50. And for me it was always their ability to advocate for themselves, or their ability to know, so like the example of the students who will reach out to you, like if they can say, I have this issue, or I'm working on something, and disclose it, it always seems to go much better than if they were someone who at the last minute might come in with a DSS accommodation or something like that. So that it didn't matter their age. And that's what I mean about the age. Is they could be 18 or 19 and be like a Gen Z, quite sophisticated in the therapeutic language, and talk to them, or they could be a 50-year-old completely in denial about the fact that they're not coming to class and stuff. So I guess for me it was like it really had to do with their ability to work with what they have and to go with it, like a chronic illness.
And I think that's very interesting, because you're going to touch on that too, because obviously there's a level of stigmatization in identifying mental health issues. And so I applaud you as a professor and your student for coming forth and saying, hey, here's what's going on with me, because I think there was a time we just wouldn't ever see that. And the student may not even recognize it and would never share it with their professor. So I think that there is just an overall climate of more awareness of mental health needs in our society as a whole, and hopefully also on campus.
It's just easier to work with for the instructors.
And that if the student comes in and says, hey, I'm really struggling with this, and I think they're more likely to do that now than maybe in other generations, and to recognize and to feel like they're going to be met with a favorable response. And then it does make our job easier, because then we can meet them where they are.
So just to piggyback on that, I was we were preparing for this presentation, I actually did some research on how many students potentially maybe even seeking services like disabled student services campus psychological services or potentially another resource. And it's interesting because according to some of the statistics that I found, it actually is increasing with time. And there was a survey that I came across that said, it was done in 2015, and it basically found that about 40% of all college students seek some sort of assistance or emotional support at some point during college, which I thought was really high. And actually, in my opinion, wonderful.
Agreed.
Because it really helps us as professors to be able to do our jobs. Yes?
And to add on to that, my experience with students is that oftentimes I don't get the student seeking help, I get the family advocating for them. Like, you know, my child went through this and I need to find these resources for them. I know the last recent one is your mom, even mom and dad and brothers and sisters were there. She's just gone through an assault, sexual assault. So I knew then we weren't capable of doing that, so automatically referred to the Longest Trauma Center. Hopefully they went through the referral and through the process, but that's just what I observed. I get phone calls, you know, I reached out so they can provide this service, and my child has been going through this, and I need this, and I need that. So it's not the student themselves, but it's the parents or the family members that's looking for help for them.
Yeah. Well, it's good. If they have that person available, it's wonderful.
There's a question.
Yeah, I just wanted to add that one of the things that I feel, you know, always alarmed is when we get some sort of alert as faculty that something's occurred on campus. We're just out adjacent to campus related to students. It's always concerning, but I feel really proud of our school for making an effort to make it well known that those things are happening and not try to squelch that somehow or you know, just to say, hey, these things are happening, we know it, we're not okay with it, and we're going to protect all of you. And I think that just that in itself, I think, makes students feel like they can come to us and that we approach those difficult issues and that we care about them.
Yeah, agreed. And I think some of the advice or I guess recommendations we're going to be giving as we move through the presentation is similar to that, is to make it known that we do care, that we are taking your issues seriously, and I'm really glad our campus does that as well.
And I think one of the issues in that you're bringing up, a collateral issue, is that it gives the students a sense of empowerment. Because a sense of powerlessness translates into depression. All this is going on, this is happening, this is a scary place, and there's nothing I can do, and nobody's going to listen anyway. So I think that empowerment is a positive resilience factor, and I'm glad our campus does it too.
So this, we're planning to do a social media campaign just with our social media feeds about mental health and resources available. Even CAPS has a lot of just self-applications that students can download to deal with anxiety and things. So we're planning to do that maybe twice a year.
That's wonderful.
That's great. That's fabulous.
Yeah, I have one.
I don't know if this is a real mental health issue, but I think it might be borderline where I'm curious too about the student who acts out aggressive behaviors, not where they're threatening you, but for example, when you get an email and it's very aggressively the tone is very aggressive. And I was thinking about what Deb just said about powerlessness and how sometimes people who feel powerless will act out very aggressively, not necessarily physical aggression, but verbal aggression, tone of voice, and their attitude and their gestures towards someone.
Yeah. And I think that I know that I personally experienced that from students sometimes too, and I hope that our discussion today will also include ways to respond to that, because there are some ways to respond that potentially may assist the student to really kind of feel heard and understood, and maybe even seek out ways to be able to understand where that aggression is coming from.
I think that's important because I could also see a professor not responding to the idea of I hear you and coming across aggressive,
Meeting
and
aggression
escalating.
with the
Escalating, meeting aggression with aggression, and escalating the situation.
Yeah, which is
that can happen.
Yeah, it does happen, and it's unfortunate because it doesn't usually end up in a positive way.
It's not happening.
Yeah.
And aggression has lots of roots. but one of the things that I think is important is that some of our younger learners have a teensy bit of the entitlement thing going. I don't know if you can relate to that at all, but I want this, I want it this way. I have a conflict on that day. I can't come for your final because, you know, I got stuff to do. So there is a little bit of that, and I think that feeds the aggression a little bit, that sense of, you know, I kind of need to have it the way I need to have it. And so that's difficult, I think.
All right, so I think we've touched on some of these. There are many, many different types of difficulties that students may experience when they're here on our college campus. These are just a few. This list could go on and on and on. But time management, school stress, adjusting to college, relationship difficulties, food insecurity. Maybe some of you have been reading. There are some efforts on our campus to address this. It's certainly a source of stress for some of our students, as well as housing insecurity. Loss of a loved one, childhood abuse, types of issues which may be coming out when they are here, because this is a time when they, especially for our undergrads and sometimes for our grad students as well, but this is sometimes the first time they are out there on their own, you know, experiencing life, making decisions, and interestingly enough, when stress happens, and it does because our academic curriculum may be challenging and stressful, sometimes those other issues kind of come to the surface, and students may find themselves having these issues that they potentially have had for quite a while, but have not necessarily dealt with.
For instance, someone who maybe has a history of some childhood trauma, and maybe physical abuse or emotional abuse that they've experienced in their lifetime. So you as a professor, you basically come in and say, oh, this is not the way this paper should look. And the client, the student is triggered by that. They have a reaction beyond what we would kind of expect them to have, because that links into some other triggers that they're dealing with. So I think those kinds of issues show up kind of in our everyday life as professors.
Okay. So we know that some students definitely develop issues while they are here. Some come in with pre-existing mental health conditions, and many issues have never been diagnosed or treated for our students. So we have a short video that we would like to show you to highlight some of this.
As students head back to campus, colleges and universities across the country are facing a growing
There she is.
demand for mental health care. Schools have long provided counseling, but increasingly, colleges are facing new dilemmas about how to best treat a student, especially one at risk. Hari Srinivasan is in our New York studios with the story.
In fact, rates of anxiety and depression among college students in the U.S. have soared in the past decade. There's more awareness of problems, risks, and diagnoses. And combined with the stresses of college life, schools are trying to figure out the right course of treatment, counseling, and intervention. The Chronicle of Higher Education examined this in a new series about what it calls an epidemic of anguish. Jennifer Ruark is the editor of the series, which has been in the works for 10 months. And Mickey Sharma joins us. He's the director of the Association for University and College Counseling Center Directors. He's director of the Office of Student Life Counseling at Ohio State. So Jennifer, I want to start with you. Your reporter spent a long time on this series. What did you all find?
Well, we found that colleges are seeing an increase in the number of students who report to counseling centers with anxiety disorders, with clinical depression, and they're also seeing more incidents of serious situations that need immediate intervention.
So, Mickey Sharma, I'm watching and I'm thinking about this and saying, listen, haven't the stresses of moving away from home, perhaps the big breakup with the girlfriend or boyfriend or partner, bombing a test when you get there, hasn't that been around for decades, as long as college has been around? What's so different about the student population now?
Well, I think there's many things that have caused some of these changes that Jennifer alluded to. I think the stigma regarding mental health has decreased locally here at Ohio State and nationally across the country. Students are more apt to reach out and meet with a counselor when they're struggling with things. We have students in this generation that are working and growing up in a very fast-paced society. There's additional stressors, more things that they're carrying on their shoulders, and there's an increase in the anxiety that we see in students. Traditionally, historically, depression was always the #1 thing that students brought to university counseling centers. About 4 years ago, that flipped, and now anxiety is the #1 presenting problem that students bring to the counseling center at Ohio State, as well as nationally, and depression is #2, and that divide between anxiety and depression grows each year.
Jennifer, are there schools dealing with this change differently? I mean, in a couple of your stories, I found that one school really tried to send a kid away as fast as possible to get help, and another school didn't. There doesn't seem to be any uniformity.
Every school obviously wants its students to be in an environment where learning is possible, both for the troubled individual and for the rest of his or her classmates. But the care that they're able to offer varies widely from campus to campus. You have some college campuses that are able to have an on-site psychiatrist, but there are many that don't. There are many campuses which don't have as many hours available at their counseling center, who are staffing the center with interns or trying to rely more on peer education and faculty intervention simply because they don't have the resources that they need.
Vicki Sharma, you're at one of the biggest schools in the country, probably better resourced than, say, community colleges or graduate schools around the country that might also be dealing with these populations and these challenges. Well, what are the appropriate boundaries for an institution of learning today between caring for the mental, the physical, the emotional, the psychological well-being of a person? Because someone's going to ask, listen, wasn't your job just to be at university or college and help teach? Now we're really asking you to think about healthcare, mental health care.
So I think that the job of the university is to provide, as much as it can in terms of support services to help students be academically successful. And at the end of the day, that's what university counseling centers are doing. That's what my center is doing, is providing support to students so that they can come to the university, be successful, graduate, earn their degree, and launch their career. So for many university counseling centers, what we're doing is providing short-term treatment and on a time-limited basis at many centers so that we're able to provide students and reach as many students as possible. Additionally, many centers have evolved into providing a menu of service options. So the majority of what we do is individual counseling. There's a lot of group counseling that we offer, as well as drop-in workshops to get coping strategies, better stress management strategies in the hands of as many students as possible.
Jennifer, what did your reporters find about the balancing act that some schools are having to do between trying to have their student populations safe and well cared for on the one hand and balancing privacy rights on the other?
Well, a college is not going to know whether students come to campus with pre-existing mental health conditions unless the student or his family chooses to disclose that. About 1 in 4 students reporting to campus counseling centers now are already on some kind of psychotropic medicine, in part because of the lifting of the stigma that you referred to earlier. So if a faculty member or administrator notices a troubled student or notices signs that a student may be troubled, they can encourage that student to seek counseling and to talk to people, but unless it becomes a crisis situation, they can't really force the student to seek counseling.
Vicki Sharma, tell me a little bit about the challenge that poses. If you have a larger population coming to you year after year who might already have been in therapy for several years before they come to college, or if, as Jennifer referred to, if they're already on prescription medications, what does that do when you have to talk to them first?
So in terms of what that does to the services at the University Counseling Center is it forces us to look at different ways to reach students. So as I mentioned before, we do have in our center the individual therapy is the #1 thing that we do, but we also have psychiatrists who provide treatment. But we also look at other forms of resources to provide students, such as psychoeducational programming, the group counseling that we provide to reach more students simultaneously, and look at matching the services to a particular student's need. I often tell our faculty and staff, just because a student is crying does not mean he or she needs psychotherapy. Sometimes that's actually the emotional response that I want to see. So we're looking at getting the right level of service to match an individual student's need.
Thank you, Chairman Jennifer Rohr. Thanks so much for joining us.
Thank you.
Thank you.
Great. Okay, so, it is, does anybody have any comments or anything from the video? Any questions?
I mean, I can go on. So my job for 12 years was the other side of that, which is the Dean of Students side of it. And it's delightful that students will go when they come in with their families and self-report themselves to the counseling center, but that's not usually the way it goes down. Usually what happens is they act out in class or in a residence hall and they have a crisis. Or in my experience was they would forget to take their or decide I'm not going to take my medication because that's for babies because there's no longer parental supervision.
Yes. Yeah.
You know, so there'd be a variety of issues. So it's good when they can go, but a lot of times my experience was the flip side, which was being the first line, and that's what I think why I'm here too, because a lot of faculty were the first line in a situation like this, because most people would go to a career counselor and reveal their issues because there's not this stigma of they're going to lock me up,
Yes.
or you know, et cetera, et cetera.
Yeah.
I mean, there's a whole. My thing is that the students also, I noticed in my career since the early '90s, it's also legislative. The Americans with Disabilities Act and the rise of Prozac and then other SSRIs that became more effective meant that students could come to school finally, and it was a great thing, but that also sort of seemed to increase a lot of the issues related to this too. So.
Yeah. You're absolutely right, and you're absolutely right about the fact that oftentimes it doesn't go down in that way where students come to us with their mental health issues already diagnosed and they're already on medications or whatnot. And we do see a lot of students, and we are the first line. You're so right with respect to that. And so that even makes our job even more difficult because we oftentimes are in a very precarious situation because our role as a faculty member is not to necessarily provide mental health services or even to be that assistant to help them to get to mental health services, but we have to because it's impairing their ability to function in the classroom.
This is what I'm here too. This is the first time in my career where now I'm on the faculty side of it,
Yeah.
where I used to work with faculty as a dean of students, which is rightfully so. I mean, yeah, they weren't in the care delivery business, and also it would be kind of weird for them because they had a different relationship. I know I have a different relationship with students now as a faculty member.
Yeah.
So you want them to do well, but you also don't want to be a cop or a therapist, and it's really hard to draw boundaries in that way. It's gerrymandering.
It's true, yeah. It's so true. And we are hopeful that today we can potentially talk about some ways to draw some boundaries and to be able to help students to seek the help, the professional help that they need from a professional, not from you as a faculty member, but that you potentially may be able to help them to access those services if and when they need them. So, you know, as you kind of saw, oh, sorry.
You were just saying about the video that we just watched. Two things that stood out to me when Mickey said 1 in 4 students are on, I don't know whether it was psychotropic.
Yeah. Yep. They're on. Yeah.
That stood out to me, and then at the end when he said it's important to know that certain emotions are he didn't say normal, but like crying.
Yeah.
It's important to match the correct services.
Yes.
To the situation, so not.
Yeah, agreed. Yeah, so the psychotropic medication piece, a lot of campuses actually have psychiatrists, and I'm almost certain that our campus has a psychiatrist. We did have a psychiatrist. I know that the psychiatrist changed at one point, but I think we have one again. But the director of CAPS will probably touch on that because, as Jonathan mentioned, sometimes people come with medication and then they decide, I don't want that anymore. So it becomes problematic because it impairs their academic functioning. So it's more common to be on some sort of psychotropic medication for anxiety or depression. And we have to deal with that too as a faculty member. But I think that the 1 in 4 is really important. 25% come with psychotropic medication, but mental health problems are really, really quite common. You know, it is a myth that most people don't have mental health issues. Sometimes during a person's life, they will be able to they will experience some sort of mental health issue, and it is quite common. The most, and as you heard from the video, the most common are anxiety and depression, but there are others, and there are a lot of others, and we wrote some of the others that commonly come up in the literature, and I think that many of you have experienced individuals who potentially have some of these issues that are showing up in your classroom as well. Okay. All right, so just a few examples, and I actually wrote these because these were examples from my life. You may have different examples from your life. So number 1, a first-year student who was sexually abused by his stepfather refuses to go to class after meeting the teacher who wears the same cologne as his stepfather. Something that the student didn't like the teacher, didn't like the instructor, but didn't necessarily have the insight to know why they didn't like the instructor. And so then became somewhat demanding with respect to, I want a different instructor, I want a different option. Okay, and sometimes, and then I know all of you share this difficulty with me, sometimes that's not possible, right?
And I think looking at it from the faculty perspective, the student, we talked about just the idea of triggers, something triggering a response that has nothing to do with the actual situation. In this case, it comes from childhood, but that the faculty member has no idea why the student is behaving in this particular way. The student is being difficult and disruptive. And I think that comes back to perhaps your thought on what is our role, what are our parameters, what are we expected to know, and you're not expected to be the trained mental health professional. So I think it comes to what is that role within the classroom, within the advisement situation, to recognize when it needs to maybe be moved on to the next step. So I think maybe the first step for faculty is just recognition. You don't have to know exactly what's going on, but recognition that something is out of the box here for this student. I don't exactly know what it is, but there's something out of the box.
And then number 2, a first-year graduate student has been having difficulty at her practicum site. She does not follow direction, has difficulty with attendance, and argues with her supervisor. Another, I think, relatively common experience. Most people have had that at some point, right? And again, this is something that potentially may be coming from a very different issue, and may be manifesting in terms of these types of issues and situations. Right. Okay. So I think we'll go on with this one, and then we'll hand it over to our guest. So some of the manifestations of some types of issues on the emotional side: anger and irritability, maybe a flat affect, guilt and shame, fear, anxiety, worry, and sadness. In terms of school performance, I know one that I see relatively more than other things is impaired concentration and low attention, sometimes low grades or attendance issues. Oftentimes, students are unaware of underlying mental health issues that potentially may be impacting the way they are presenting to us in class.
And I think the other one that kind of goes along with those is just overreaction. That the client gets a paper back and it's like an A- and there's 2 points off that paper. And just an overreaction beyond what you would really expect. So they become despondent, they become extremely upset, they're coming into your office, you know, I'm failing or whatever, they become angry. So the reaction to what's happening in the situation is bigger than the situation. And I think that that's kind of an indicator that there may be something else potentially going on that's feeding that reaction.
Okay, so Carmen?